Hi everyone, welcome to the Facebook Live. Myself, Dr. Vachini. Cuts, even the small cuts, makes big impact. When the precision meets compassion, even the lung cancers can be treated with the minimal pain and maximum hope. To talk on the beautiful topic, the keyhole lung surgeries for the lung cancers, we have with us Dr. Abhishek Jain, who is a consultant breast and thoracic oncosurgeon. Hi Dr. Abhishek, welcome to the live.
Good afternoon, very good afternoon to all of you.
Yeah. Before we begin with the interactive session and the actual question answer, I just would like to share with you, okay, whenever we heard the lung cancers, it brings lots of fear and silence in the homes, in the hearts, and that's why the most of the people just hesitate to share about the lung cancer. And this is the right time to spread the awareness on it.
Absolutely.
What is your thought on that?
Yeah. See, so lung cancers, I would just like to share a fact that lung cancers are the most common cancers across the globe in males.
Okay.
And breast cancers are most common in females. So lung cancer is definitely a very big problem for the entire humanity. And it is causing a lot of morbidity and mortality.
Exactly.
Lot of deaths are happening every year because of lung cancer. So it is a big problem, and it is worth a discussion for today.
Actually. So let me begin with the frequently asked questions. Of course, you must have received that. Is lung cancer curable?
Yeah, so that is a wonderful question. Everyone keeps on asking this question to me. So lung cancer, like any other cancer, is curable, treatable, if it is only and only if it is detected early in a very early stage. So it can be cured, definitely.
Okay, so there is a hope to recover and to heal.
Absolutely.
Right? So when we are talking about the lung cancer, my first questions to you is that what are the risk factor and causes for the lung cancer?
So the most common risk factor for lung cancer development is the habit of cigarette smoking. As you all know, cigarette smoking is a very big problem for causing all other diseases like cancers and diabetes and hypertension and other problems. So it depends on the amount of cigarettes smoked and the number of years which the person have smoked. So it is directly related to the how early the lung cancer will develop in the particular person. Other than cigarette smoking, the exposure to the radon gas, which is naturally present, which gets leaked from the rocks and soils. So the increased exposure to radon is also a second most common, and in the US it is the leading cause of lung cancer development. Other than these two reasons, there can be lung cancer because of hereditary causes, but it is a very rare, less than 1% of the chances. It is because of that. And the fourth reason, if someone has taken radiation therapy for any other cancer in the childhood, in the chest region, then it can also cause lung cancer later on after 15, 20, 25 years. So these are the four main causes of lung cancer.
So these are the main four reasons.
So cigarette smoking being the most common.
The addiction and the environment.
Almost 80 to 90% of the cases, lung cancer deaths are because of cigarette smoking.
Yeah, I agree to that. And I mean, we are observing that day by day the addiction to the different substance are increasing. If we are talking about the clinical picture, the sign and symptoms of the lung cancer, what would be that?
So the most common symptom of lung cancer could be a relentless, non-treatable cough. I mean, patients can complain of chronic cough which is not getting relieved because of medications for more than 2 to 3 weeks. Sometimes patient can develop hemoptysis, which is the development of coming off blood in the cough when the patient expectorates. So this could be the second symptom. In advanced stages, patient can develop with a chest pain because of the lung cancer which has spread and reached up to the ribs or the chest wall. In very advanced stages like stage 4, patient can have symptoms because of the metastasis. Like for example, if the lung cancer has spread to the brain, they can have constant headache, sensation of vomiting. Patient can have generalized weakness. Patient can have weight loss because of metastasis spread to the liver. So all these can be the symptoms, but the most common symptom of early lung cancer is the presence of chronic cough or chest pain which is not getting relieved.
Exactly. So when we are talking about the any cancers, the stages of the cancer are very, very important. And if we are talking about the lung cancer stages, वो कैसे होते हैं?
So like every other cancer, lung cancer may be 4 stages होती हैं. Every cancer has 4 stages, stage 1, 2, 3 and 4. So stage 1 हम तब कहते हैं when the tumor is limited to the lungs. Stage 2 is when we call it stage 2, when the lymph nodes are getting involved, the lymph nodes surrounding the lung are involved. So it is called stage 2. When the mediastinal nodes are involved, we call it stage 3. And when the cancer is spread to distant organs, it is called stage 4.
Okay. Then what is the importance of the early diagnosis and the screening in cases of lung cancer?
Yeah. So like every other cancer, like breast cancer, there is a screening protocol present for lung cancer also. Screening method means you can detect the tumor when it is so small and when it is not causing any symptom. So the screening protocols are mainly for asymptomatic population. So the person or the population which qualifies for lung cancer screening is chronic smokers between age 40 to 80 years, those who are smoking from more than 15 years, 10 years, and those who are between 40 to 80 years of age, they can be screened with means of low dose CT scan. So basically it is a CT scanning for lung cancer screening, but very low doses given so that the patient is not exposed to higher radiation doses. So LDCT we call it in common terms. It is the main method by which we can detect and screen patients for lung cancer, and the lung cancer can be diagnosed at a very early stage, maybe stage 1. And it can be cured.
So that's why the early detection.
So that is the advantage of cure. Of doing a lung cancer screening. So lung cancer is curable when it is detected in a very early stage, and this can happen only with the use of screening methods.
Exactly, because otherwise the cancer is such a silent disease that it cannot come up with the symptoms when it reaches to the second or third stage.
And by the time it has caused symptoms, it is very late. It is very late. Then you cannot cure.
And that's why the screening and diagnosis, the early detection is a very important. If we are talking about the available treatment options, the possible treatment options, what are those?
So there is a lot of advancement which has taken place as far as the treatment for lung cancer is concerned, and it has happened in all the 3 fields like medical oncology, radiation oncology, and surgical oncology. So if I talk about medical oncology, very new targeted therapies like targeted therapies and immunotherapies, they have come for lung cancer. From last 10 to 15 decades, the use of minimally invasive surgical techniques have taken a giant leap forward, and they are very commonly being utilized for all the lung cancer patients. And in minimally invasive surgeries, we use small cuts so that there is very less post-operative pain to the patient. So main advancement which has taken place in surgical field for lung cancer is the use of minimally invasive surgical techniques.
Exactly. And what are the latest techniques for the lung cancer surgery?
So for lung cancer surgery, as I said, the use of minimally invasive surgical techniques have taken a very giant step forward. So for lung cancer cases, now we do a minimally invasive surgical technique. We use that technique which is called VATS lung surgeries. So the full form of VATS is video assisted thoracoscopic surgery. So in VATS lung surgeries, we use small 2 to 3 ports of size around 5 millimeter to 1 centimeter, and we make a very small 3 to 4 centimeter cut, and these 3 incisions are the only incisions which we use for removing the same tumor which was earlier being removed with a 15 to 20 centimeter incision, which is called a thoracotomy. So in last 10 to 15 years, we are using these VATS lung technique for removing the same tumor from the body. So our latest advancement in VATS technique is the name of the procedure called Uniportal VATS technique. So instead of 3 to 4 incisions which we use for VATS lung technique, Uniportal utilizes only a single incision of 4 to 5 centimeter. So it causes a very less post-operative pain to the patient, and patients get recovered very soon. So in 4 to 5 days you are able to discharge the patient, which earlier used to take around 8 to 10 days. Now we are able to discharge the patient in 3 to 4 days. I've discharged my patient as early as 3 days after surgery because of this Uniportal VATS lung surgery technique.
So this is the huge benefit of the advancement of the cancer surgery treatment. I mean, you have said that from the conventional open surgery to the VATS and then Uniportal VATS surgery, the one incision only.
So instead of a single 15 to 20 centimeter which is this big, we are using only this small size incision. So it causes very less pain to the patient.
And less hemorrhages.
And fast recovery, and because of that less cost to the hospital stay.
Wow, that is so nice, and that is a benefit to everyone.
Absolutely.
When we are talking about this advancement in the surgery, I mean, what is the advantage of the 3D camera?
So as I said, these are all minimally invasive techniques, VATS, Uniportal VATS, or robotic surgeries, for example. So these are all minimally invasive techniques, and for doing all these surgeries, we use a camera system which is available either in 2D or a 3D. For 3D, we always use 3D goggles, right? The way you see 3D movies in the theaters, in the same way we wear 3D goggles, we look at the monitor. And because of this 3D vision, we are able to see all the important structures, the big blood vessels which are around 2 centimeter wide. So we are able to dissect properly, and with very less complications, we are able to do the entire surgery. So that is the advantage of 3D vision. So it gives you an excellent vision with a precision in the surgery.
Okay, and as you have mentioned earlier that from the conventional open surgery, it is better to have a uniportal VATS surgery. Any major differences? So
the main advantage of uniportal VATS surgery is that it causes less post-operative pain. Second, the patient is able to move very early after surgery. I mean, in the evening of the surgery, we move the patient. Third, patients are discharged very early as compared to 8 to 10 days earlier. Now we are able to discharge the patient in 3 to 4 days because of uniportal VATS. And because of all these things, patients are able to do post-operative physiotherapy very early, and because of that, the hospital stay cost has drastically decreased. So these are the main 5 advantages.
As you have beautifully explained the uniportal VATS surgery, then what is the current status of it?
Yeah, so as I mentioned, it's a very complex, this uniportal VATS lung technique is very complex procedure which needs a lot of years of training and skill. So I am also a uniportal VATS surgeon in CIMS Hospital, Marengo CIMS Hospital. I am doing uniportal VATS lung surgeries. We have a dedicated team here. We have a team of hospital staff, OT staff, nursing staff. We need special instruments for doing this surgery, very long special instruments. These are very costly instruments. So everything is available here. And I am amongst one of the very few surgeons in the entire country. I mean, only 10 to 12 surgeons in the entire country, thoracic surgeons, they are doing uniportal 3D VATS lung surgery. So I am one of them, and I am very proudly, I say that in the entire Gujarat, I have got the highest series of uniportal 3D VATS lung surgeries. So this is a very special technique which needs a lots of years of skill and training.
I mean, the way we have discussed entirely about the lung cancers, from the causes and risk factor to the advancement of the treatment, I mean, it is truly beneficial.
Absolutely, it is a major revolution in the field of lung cancer.
And the number of days you have suggested that it can decrease, just 3 to 4 days, and patient get the discharge.
So patients start moving on the evening of the surgery.
And then the fasting.
It is already set in our protocol. We make the patient move in the very same evening.
Any incidents or any case you want to share with us of your patient?
Yeah, so I did one patient who was 84 years old, known cardiac patient, history of ischemic heart disease, and that patient came with a very rare lung cancer called sarcomatoid variant of non-small cell lung cancer. So it's a very extremely rare case. So I did that surgery in that patient of 84-year-old, a known case of ulcerative colitis and heart diseases. So in that patient, I did a uniportal VATS right upper lobectomy. So that tumor was present in the upper lobe of the right lung. So I put a small 3.5 to 4 centimeter incision. I was able to finish the entire surgery along with a lymph node dissection. So in lung cancer, you have to do a lobectomy along with lymph node dissection. So from the same single incision, I was able to finish the entire surgery in 3 hours. The patient got discharged on the 8th post-operative day, and the patient is doing absolutely amazing. So in 84-year-old patient, we were able to do the surgery just because of this uniportal VATS technique. Otherwise, if I had put a small incision of around 15 to 20 centimeter, the patient would not have recovered from that surgery. So that is the beauty of this.
That is the beauty of this.
So because of this technique, 4 centimeter incision, I was able to take that daring step of going for surgery in this patient.
I understand. So that is really, as you have said, that it is a beauty of advancement of the treatment, uniportal VATS surgery. Anything at last you want to share regarding the prevention?
So for all our audience, I would just like to say one thing, that please get yourself screened. If you are a chronic smoker, you are between the age of 40 to 80 years, there is a low dose CT scan method available to detect all the lung cancers when it has not caused symptom and when it is at a very early stage and still curable. So if you qualify in this group, if you are a chronic smoker, please get yourself screened for lung cancer. Screening facility is available in almost all big hospitals. It is also available in our hospital also. So you get a low dose CT scan done if you are a chronic smoker.
The screening is most important in the cases of cancer.
It is the only thing which is preventing mortality because of cancer.
Of course. So thank you so much, Dr. Abhishek, for joining us and sharing such a precious knowledge.
Thanks.